I am Peggy Walker. Throughout my career as a teacher, lawyer, and a judge, my work is focused on children and their families. How do we support families that have experienced adversity in a way to allow them to not only survive, but also to thrive? Young children ages birth to 3 tend to enter foster care in greater numbers and stay in out-of-home care longer. Focusing on these families, I noticed that many of these children were born into families with significant challenges. Many of these children were prenatally exposed to tobacco, alcohol, and other drugs. A plan of safe care is a tool for serving these families. It goes beyond the immediate safety needs of the child to focus on health and well-being of the entire family. Its purpose is to provide support and connection for all family members when substance use affects children prior to birth and after birth, for better health and safety for children and their families. The plan of safe care changes in response to the family's needs and circumstances as the family engages with each agency or partner in contact with them. Judges do much more than preside over cases that come before them. Judges have a vital role in convening stakeholders, building partnerships, identifying services and resources, linking those in need to services and resources, and breaking down barriers. We also have a role in identifying gaps in services and resources to inform policymakers and budget decision makers what we need to do our jobs and help our families to succeed. We also convene stakeholders to analyze our data and make changes based upon what we learn. Sharing our data, knowledge about reasons for removal, and challenges our families face informs policymakers in making legislative changes and in resource allocations. Judges must continue to educate themselves on changes in federal and state law that impact our work. Georgia adopted statewide policy when the Child Abuse Prevention and Treatment Act, referred to as CAPTA, required plans of safe care. But there was no training or implementation plan developed to support the policy. The Comprehensive Addiction and Recovery Act, referred to as CARA, was passed amending CAPTA to expand plans of safe care and state reporting requirements for affected children born exposed to both legal and illegal substances. This amendment resulted in increased numbers of cases and efforts to utilize plans of safe care to improve outcomes for our children and families. Substance use, particularly opioid use, has increased dramatically. Mothers were going to the emergency room of our local hospital when they went into labor. The mothers had no prenatal care and often gave birth to small, fragile infants with drug exposure in hospitals that were not equipped to handle neonatal crises. The infants were flown to other hospitals, separated at birth from their mothers, starting a trajectory to disrupt bonding and attachment, which are vital to the growth, health, and well-being of babies, especially medically fragile babies. As stakeholders in our community, we looked for a better, safer way to serve our babies and their families using CARA's requirement to include the needs of the infant and the family. In order to serve families affected by substance use disorders more effectively, an understanding of the CARA Amendment to CAPTA is fundamental. After an adjudication of dependency, the parents must remedy the issues identified. The judge must review case plans prior to incorporating them into orders to assure that each parent and child receives the services necessary for safety, permanency, and well-being, and address family time to support bonding and attachment of young children. As leaders, we have to make sure that plans of safe care, like dependency case plans, result in change, not checking the boxes. A plan of safe care helps by identifying issues early and connecting families to resources even before a case plan is written. Courts make findings that inform caseworkers and other stakeholders about the scope of the plan necessary to support each family. We must know what services are appropriate and family-centered to assure that change happens within an accelerated time frame. Creating a sense of urgency helps us engage parents, caseworkers, and providers. With young children, frequency of family time is important because it builds stronger relationships between children and parents and motivates parents to work diligently to complete their plans. Judicial leaders also have the ability to convene stakeholders from the community. Through our Quality Improvement Center for Collaborative Community Court Teams project, the Baby Steps Recovery Program was formed to provide case management to families with plans of safe care. The goal was to build partnerships and trust in the community to encourage families with substance use issues and pregnancy to engage in case management services for a year. Those partnerships with the birthing hospital, medical professionals, treatment providers, peer support specialists, public health and child welfare staff allowed us to improve our practice by keeping families together. Utilizing peer support helped build trust and engagement with families. Peer support specialists help break barriers for families in entering substance use treatment and staying in treatment. As a state demonstration site, we created a toolkit and are working on curriculum to train other communities implementing plans of safe care. We all have a role in prevention. Through community referrals, families are linked to what they need. Our case manager helps families build skills to address safety as well as the social and emotional needs of children. Enhancing bonding and attachment by education on social and emotional needs of children reduces the likelihood of future abuse and neglect. It also provides the foundation for early learning, emotional regulation, and mental health. Judges must encourage, support, and facilitate communications among agencies and providers serving our families. With partnerships and improved communications, the requirements of the court are consistent with the medical discharge plan for the child and the treatment plan for the parents. The plan of safe care helps address these issues and inform the court as to what is already in place for a family. As an example, our Baby Steps Recovery Program assisted a pregnant mother with ongoing substance use disorder and prior termination of parental rights cases. She voluntarily engaged in case management and helped develop her plan of safe care. She received substance use treatment and education as to the services available to her through the program. Her OBGYN and the birthing hospital had her plan of safe care and knew what services and treatment she received throughout her pregnancy. At birth, when the carer notification was sent, the mother was able to share with child welfare her plan of safe care that included her support system in the community, her substance use treatment, and her continuing case management for a year through baby steps recovery. Investigation and removal were not necessary because safety was not an issue. Family preservation services were not necessary because she had what she needed and she knew what to do. No child welfare interventions were necessary. This type of early intervention keeps families together and best serves infants and mothers. Together, we can keep children with their families safely through compassion and support so that our children have the same places and the same faces, surrounded by those they love and those that love them. All of us want our babies to be healthy, safe, and loved. We want them to have safe, nurturing environments and caretakers. We are better together as families, communities, states, and as a nation. Thank you for this opportunity to change lives and improve the health of our babies, mothers, and families utilizing plans of safe care.